Welcome, everybody. Good afternoon. My name is Tanisha, and I'm here with the Hillsborough County Public Library. And this afternoon, we are presenting medication safety for seniors. We are joined by Ms. Jemima Duget with the Florida Poison Control Center, and she has a really awesome presentation for you today. So I am going to go ahead and kick it over to Ms. Jemima.
Good afternoon, everyone. I am Jemima Duget, the healthcare educator at the Florida Poison Control Center. Today, we'll go over medication safety. I will be looking forward to your questions at the end. When we talk about medication safety, today we will talk about common causes of medication poisoning. We'll discuss some strategies for safe medication use, storage, and disposal, and we'll discuss some first aid tips, and of course, how can the Poison Control Center assist you? Medications can be anything you are prescribed by your healthcare professional. Over-the-counter medications that you buy yourself. It can be something for pain, like aspirin, ibuprofen, antibiotics if you have an infections, cold, cough, and flu. We know flu season is about to start, so a lot of time we buy something to help with that. Or topical ointments, things like antibiotic rubs or anything for pain that are topical ointments. And of course, herbals. A lot of people don't think of herbals as medications. They are. So it's good to always let your healthcare provider knows that you are taking some herbals. So what are some common causes of medication mistakes? Medication mistakes can occur if you are taking yours, but you take the wrong medication. Let's say a husband and wife, they forgot and they took each other's medication. That can be leading to medication mistakes. It can happen that sometimes we take a dose and we forgot, we took another one. So taking too many of them is one. And medication interactions, let's say you are taking some over-the-counter medications, they can interact with your prescriptions, and also herbals can interact with your prescription medications. If you have grandchildren at home, if you put them on the counter or on the kitchen and they happen to take your medication, that can lead to medication mistake, that can lead to poisoning. So let's discuss some medication safety if you have children at home. It's good to always remind them that only an adult should give them medications. Teach them not to share with their friends. They should not take it to school or to daycare. And also remind them that if you give them sometimes they might think like, okay, you give me a spoon to feel better. So what if I go ahead and take a couple more spoons? Maybe I'll get better faster. So remind them that taking more won't help them get better faster. Labels are important, so they should not remove them so that way you don't mistakenly give them the wrong medications. And also never put them in other bottles. Because sometimes if we put them on a different bottle, we're not going to know the dose. We're not going to maybe remember what medication it was. That can increase the risk of medication poisoning. So for you, as you use your medications, we have some good practices that we want you to have so you can use them safely. So take them with care. Always bring a list of all your medications, including over-the-counters and herbals, to all your appointments so your healthcare provider knows what you are taking. If you are taking any vitamins, let them know also, because sometimes they can have negative interaction. If you don't let them know, it's hard for them to know what's interacting with your regular prescriptions. It's good to know what medications, the name that you are taking, the dose, why are you taking them, what medical conditions are they for, and of course, how to take them, when to take them. Should I take them in the morning with food, or what time of the day? And also to know for how long. Is it something I have to take for the rest of my life? Is it a regimen that's for a week, like an antibiotic? Is it for 10 days, 7 days? To know exactly when you should stop taking them and for how long. And then potential side effects. Your medication, it's good to know what to look out for. If that medication can give me dizziness, some insomnia, so that way if that happens, you're not caught by surprise. You already know what to expect. As you use your medications, always put on glasses if you need glasses or a magnifier to see them. But at your pharmacy, many people don't know that they can also ask for a larger print. So if you ask your pharmacist for a larger print, you'll be able to give you that. And also, if you need them in different languages, they can provide you that. Other tips for safe storage: also consult your healthcare professional, your doctor, your pharmacist before you take anything over the counter. If you are on prescription medications, as you take the correct dosage, remember sometimes we can use things to remind us, like pill minders or calendars or anything that works for you and your household. Use that so you never forget to take your medications. And if you're not sure, or you're not sure you take it, it's better not to take a double dose and wait and continue as prescribed. So let's say you were supposed to take a medication at 10 o'clock and it's 1, you forgot if you took it. It's best not to go ahead and take another one, because if you're not sure, then wait and take it as you're supposed for the next dose. So create daily routine is important. If you have several medications you're taking, like morning, afternoon, and nighttime, take them with things that can remind you. Let's say you get up in the morning, you shower, you brush your teeth, then you start your day. It's good to take your medications daily. You're going to always associate it with those activities. If it's something with meals, you take it with your lunch so you can remember. Same with nighttime. If you have a nighttime routine, you look or something, make sure you associate that medication doing those things so that way it's easier for you to remember if you forgot to take it or not. As we use medication, it's important to store them properly. So if you have young children at home, it is important to always put them out of sight and out of reach. Most medication bottles, they are child resistant, meaning that they buy us time to get to them before they can open them. But some little ones are very clever, they can open them really fast. So keep them out of reach. Always put them high on top shelves. We like to have several layers of protection. Put them on top shelves, something with a lock that can make sure that they
Jamina?
never put them in your purse or the counter, or the kitchen cabinet or kitchen table. Those are easy places. Yes?
Hey, Jamima, we're having a few sound issues. So hang tight. Yeah, we're having a little bit of sound
Okay.
issues real quick. Can you start talking again real quick? Let me see if you're still coming through weird.
Okay, proper adult
So
supervision.
we
Is
may
it
have,
cutting?
you're coming through a little bit better now. Hold on just a second. All right, go ahead and start speaking again.
We were discussing to keep medications out of sight and out of reach of children, but nothing.
Yep, you're coming through a lot better now. I think we could go ahead and continue.
Okay, thank you.
No problem.
Yes. No matter how many barriers that you use, whether it's safety latches or top shelves, nothing gonna top proper adult supervision. So if you have young children in your home, make sure you watch them, or if they come in to visit, make sure you change those routines just for them and store them up high so they don't get to it. Storage for you, it's good to know also not to share them with children. Do not share medications with others. It might work well for you, and you might think you're helping your friend by recommending that they take some of your medications, but you don't know their medical conditions, you don't know what else they're taking, so that little help can get them in trouble. So never share them. And do not put them in other bottles, because sometimes we forget, if we put it in something that looks like another substance, we might mistakenly ingest it. And for children, never call medications candy, because if you look at the picture, some do look like candy. So that way we don't reinforce the concept of them taking them on their own. And put them in a good place. If you're having visitors, put them medications away. Unfortunately, some people might be looking for substances in your home, so always store them out of reach for not just children, but for visitors also. And when you are done with a medication, you don't need it, do get rid of it. Here you can see, this is a great example how to store medication out of sight for children. Put them on a medication lockbox. They have a key. Some of them are very clever that they can dispense them when your medication you're supposed to take them. They won't open until then. So try to see what works best for you and your family. Here you can see why we're talking about keeping medications out of sight for children, if you have them in your home, or even for you. Like the chocolate bar, Hershey's, versus the laxative or X-Lax. If you look, With the bottle, we can tell. With the box, we can tell what's what. But when you take them out, if you just leave that on your counter, you just ate some chocolate, you come back, you may not remember this is the laxative or this is the Hershey's, and even worse for small children. When you don't need your medication that you have to get rid of them, there are several ways to do that. So if you have expired medications or some you're not using, let's say you had surgery, you are given more pain medication than you need, do get rid of them that way. Either put them in some substance that's not appealing, like a coffee ground, and you mix them really well. You put them in a sealed container, like a Ziploc box, and then you can put them in the trash. Never take them and then dump them in the trash. Always mix them with cat litter or something that people are not gonna like. And of course, if it's a bottle, remove your personal information, cross them out, and then you can dispose them in your trash. But a lot of pharmacies have disposable box that you can go and drop them off. In some sheriff office also, you can safely dispose your medications, no question asked. And twice a year, DEA offer the Take Back Day. We have one coming up in October, so you can easily go and take them there to your local sheriff's office. Now let's talk about herbal supplements. As we try to boost our immune system, a lot of people are taking things on their own. The intention is good, but keep in mind that a lot of those products are not FDA approved. So we do not know for sure their safety or effectiveness. So if you're going to think of starting a new regimen, it is best to call your healthcare provider, talk to them, tell them which one you're taking, and they know your medical conditions, they know what medications you're on, they are better equipped to tell you if it's something you should. If you learn about something on social media or a friend recommend, never take them on your own without discussing with your healthcare provider. Some medications, they have to be used in a specific way in order for them to work. Some medications, your doctor might tell you, take it 11 o'clock daily, take it with food, take it on an empty stomach. It is important to follow those instructions because it's going to help that medication absorb and metabolize so your body can process it better. If you don't do that, it could be that something you eat or something else interact with that medication. And the labels, they're going to always tell you the instructions, what to do, or even the potential side effect like drowsiness. A lot of the labels will have that clearly stated. So even when we are careful, remember, we are human, things happen. We forget, we take a double dose, or we take somebody else's, or we take the wrong medication. So in the next few slides, we're going to talk about some basic first aid tips, something that can help to avoid making a poisoning worse. So let's say somebody got into an inhaled poison. It's an inhaler, you are not supposed to take it or you're taking too much. What to do? Remove yourself from that substance. So go outside for fresh air. Any type of inhaled poison for that matter, you can just go outside, get some fresh air, and then you're gonna call the Poison Control Center. So you're gonna call 1-800-222-1222. But if somebody can't breathe, if somebody is having chest pain and you see they're having trouble breathing or they actively bleeding, in that case, you're going to go ahead and call 911. On a different scenario, let's say you took the wrong eye drop or something splashed into your eyes, that's a poison. What do? You're going to go under your tap water, running water. You're going to get a gentle stream and let it run and wash through for a good 15 to 20 minutes. Let it wash your eyes. Do not use any other ointment. Do not rub it. Just let it wash really, really well for 15 to 20 minutes. And then go ahead and call the Poison Control Center. And once again, if somebody pass out or having trouble breathing or bleeding, you're going to call 911. In a case of a poison getting into your skin, let's say you use the one topical, you are supposed to put antibiotic, but you ended up taking a steroid ointment you put on. In that case, you're going to remove your clothes. If it's something that's splashed on the clothes, you remove it if necessary. You're going to rinse well under running water. Use some mouth soap only if needed, and then you call the Poison Control Center. But then what if somebody ingests a poison? If you swallow the poison, in this case, you're going to offer the person a little sip of water. Never force them to vomit. That's going to make it worse. So you want to make sure if there are anything left in the mouth, you remove that if possible. Give them a sip of water, and then you call the poison control center for help. And if they are having difficulty breathing, they need help right away, you call 911. We're going to discuss how can really, okay, you said to call the poison control center. Why? Who am I going to talk to? We're going to answer those questions right now. The Florida Poison Information Center in Tampa, we are 24/7. When you call us, you're going to talk to a healthcare professional. It's going to be either a doctor, a nurse, or a pharmacist. But they also have extensive training in toxicology as poison information specialists. So anything they do for you is going to be free of charge. It is a confidential call. We do not routinely share information with others. And when you call us, within minutes, we're able to tell you either we can take care of you at home or if you need to go to the emergency room to be seen. And when we do take care of you at home or wherever you are, we're going to call you back. You get a free follow-up calls to check on you, and we'll even tell you what symptoms to look out for, what to do if it's getting worse. So when we call you back, if your situation changed, let's say you were not having symptoms or now you are, we're able to reassess and give you a good medical advice right in the comfort of your home. And this is 24/7. It's always free of charge. So why would you really call us? You can call us for many reasons. You can call to ask questions. If you are not sure about something, if you're on a new medication about potential side effects, you can call us in case of an emergency. Somebody took something they were not supposed to. We're able to help you there. And we exist to be able to help hand in hand with healthcare professionals in the hospital setting or the emergency room. We can triage and let you know if you should go or not. And we also save time and money because with 24/7, you're not going to talk to an operator, you're going to talk to a healthcare professional right here and there who can help you. And 85% of the time, we're able to take care of you right at home without having to send you in. But if you need to go, we will let you know to go ahead and be seen at an emergency room. Do we only help for medications? We help a lot with medication, but that's not all that we do. You can call us for any reason, that's anything that can be a poison. It can be an overdose, something with somebody with substance use disorder, or if someone get into some cosmetic or personal care products, those little ones, the curious, they like to get on things. Household cleaners, we all cleaning and keeping our homes safe. We have a lot of chemicals at home, whether it's bleach, detergent, or anything. Let's say somebody accidentally exposed to them, you go ahead, give us a call. Even if it's something like on a professional level, chemicals that you're cleaning a product, a building or somewhere. Food poisoning, you can call us about that also. Other things we help with, whether it's bites and stings, a snake bite or a caterpillar, a spider, you can call for that. A plant, whether it's an household plant, outdoor, or even wild berries, mushrooms, pesticides, any foreign body, anything that can harm your body. If it's a poison, you call the poison control center. So when you call us, what happens? You call us the poison specialists. Remember, they are doctors, nurses, and pharmacists. What they do, they're going to look up to see what is the product that you take. Is that product toxic? And if it's not, we'll let you know. If it is, the person who was exposed, we want to know the amount they took. Is it at a toxic level? What treatment advice can we help to make that exposure not getting worse? And then tell you what symptoms to watch out for. And if you need to go to the hospital, we'll let you know to go to the hospital. And once again, as mentioned, we do follow up to check on you or the poison patient to make sure everybody's still doing well. At the Florida Poison Control Center in Tampa, we are here for you. Our goal is to reduce poisoning cases. We want to teach people, raise awareness about common things in the home that are poisonous that they may not know. We want to promote ways to prevent poisoning. But then as human beings, when something happens, in case of an emergency or an exposure, we are there to provide accurate and prompt help 24/7 for poisoning emergencies. Remember, we do not want you to share medications with no one. Whether you're taking prescriptions or herbals, they can interact with each other and lead to a dangerous mixture. You can end up with potential adverse effects. Let your healthcare provider knows what you are taking. Over-the-counter herbals and your prescriptions, of course. You want to practice safe use. So keep things as prescribed. Store them properly, out of sight if you have small children at home or visitors. Get rid of any medications that you no longer need or that's expired. And the Poison Control Center is always a phone call away. So if you don't have that number saved on your phone, right now I would like to encourage everyone, take your phone and save 1-800-222-1222. That way, wherever you are, whether you're at the park or at home, at school, at work, if something happens, you can quickly pick up that phone and call. And encourage your friends and family to share it too in case if they don't have it. So be ready. You never know when you'll need us. We are always providing information on Facebook, on our website. Go ahead and always visit those to stay current. And of course, if you need our help, we are here 24/7. Thank you so much for attending today, and I'm available to answer your questions.
All right, thank you so much. So we have a few questions for you. They're coming in. So the first one we have is, are these services only for seniors?
We serve everyone across the lifespan, whether you're a child, a parent, teenager, young adults, anyone can call the Poison Control Center.
Awesome, thank you so much for that. Another question. When you were referring to herbal supplements, does that include like vitamins, like vitamin C, vitamin D, all of that? So any of that stuff you can buy in the pharmacy, like not from the pharmacist, but just in that like the area like right around the pharmacy?
Yes, anything that you can buy yourself, whether it's a supplement of any kind of vitamin, like you said, vitamin C, vitamin D, B complex, or anything that people buy on their own, always share that with your healthcare provider because they might have potential risk to interact with your medications.
Okay, perfect. Let's see if we got anything else here. We're gonna wait a few minutes. Oh, and we got another question. Is this number service only for Tampa residents?
In Florida, we have 3 poison control centers. The one in Tampa, we're not just serving Tampa. We actually serve 16 counties, but throughout the state, you are covered by all 3 poison control centers. We work as a network. So wherever you are in the state, you can call the number. But on top of that, wherever you are in the country, the poison control centers is the same number. So if you have that 800 number saved, you can call and you'll be connected to your closest poison control center.
And we did put that number in our chat as well. So if you look at the chat part of your control panel, I went ahead and posted that so that I think it's on her slide here. Let me move that. Yeah, it's on the slide too. So we have it in 2 places so you can be sure to get that number. And going off of that, if you Google Poison Control Center, will it automatically send you to your local one? Will it send you to the national one?
In a perfect world, we hope that it will connect you to your nearest one, but we don't encourage people to just go to Google for things because it's not specific. You can get in trouble and you can really get into it. And
absolutely.
Information, just go ahead and give us a call and we'll help you.
All right, yes, that's exactly why I wanted to ask that question. All right, we'll wait a couple more minutes to see if we have any other questions roll in. While we're doing that, I'm going to go ahead and kick it over to our contact slide here. And also, there is a survey in the chat for the Poison Control Center as well. They have a survey that they would really love for you all to fill out. So if you go to the chat area, there is a survey for them as well. So please feel free to fill that out as well along with ours. Let me go to sharing. Yeah. All right, so We put our contact info up. So thanks again, Ms. Jemima, and thanks for joining us, and have a wonderful afternoon.
Thank you. You too.
Bye.